Thank you so much for joining us to talk about nicotine pouches today. It's a hot and important topic. We're going to get to that in a minute. First, I just want to give you a quick overview of what we do here at the Public Health Law Center. This is a picture of our campus. We're based in Minnesota, St. Paul, Minnesota. At least our physical offices are. We would like to recognize that we occupy land in the traditional homelands of the Dakota people. We'd also note that we're working with Native communities to reclaim their traditional practices through culturally appropriate public health policy. The center is a national nonprofit. We work to reduce and eliminate the use of commercial tobacco. We promote healthy food, support physical activity, tackle climate change, and address other causes of chronic disease. And this is a picture of our team, actually a picture of pictures of our team. And as I mentioned, our physical office is located in St. Paul, and we're at the Mitchell Hamlin School of Law. But the folks on this screen are actually spread throughout the country. At the Public Health Law Center, we provide legal technical assistance to public health professionals, attorneys, and advocates throughout the country. This legal TA that includes help with legal research, assistance with policy development. We provide litigation support, including friend of the court or amicus briefs, mostly in high impact cases. We develop publications and trainings and webinars like the one we're doing today. And really our goal is to try to clarify and explain and shine some light on otherwise complicated and opaque subject areas. We do many things, but we do not provide representation and we do not lobby. So this is just a quick note about terminology today and in all of our presentations. We use the term commercial tobacco purposely. We want to emphasize the harmful and addictive products that are created by the tobacco industry. So we are not referring to traditional use of tobacco by indigenous communities. As many of you know, tobacco has been used by many Native American communities for prayer, offering, and ceremonial purposes since time immemorial. So when we use the phrase tobacco, we mean commercial tobacco as opposed to traditional or sacred use. Another slide just to kind of center health equity, which is what we do here at the Public Health Law Center. Equity is understanding barriers, circumstances, and conditions that are prevalent in our society. So in an equitable society, one that we're striving towards, your race, gender, sexuality should not be determinative or predictive of your health and your happiness. And this is another slide sort of building on that theme of the social determinants, and there's also the political determinants of health. These are external factors that can help explain why some people are healthier than others in our society and why some people generally are not as healthy as they could be. And so these social determinants of health are various conditions in the environment. You can see this relates to food, education, the healthcare system. These affect a wide range of health functioning and quality of life outcomes. These also help explain, at least in part, why the leading causes of poor health and death in the United States are chronic diseases that are largely preventable. So cancer, heart disease, high blood pressure, diabetes, and tobacco-related illnesses, for example. The root causes of many of these health threats are linked to a person's opportunity to attain good health and adopt healthy behaviors. Okay, here's our roadmap. This is what we're going to be doing today. We're covering quite a bit of ground. And I just want to note at the outset, this is more of a primer, an overview. This is going to give you the basics of nicotine pouches, but we're not going to do a deep dive. And the truth is we could probably spend a whole webinar on each of these subtopics. But the idea is to give you a sense, especially for those of you who may not have much familiarity, may not even know what a nicotine pouch looks like, and they want to know more. So just be sure to put questions in the chat. There's probably a lot more information we'll be covering in future resources or webinars, but go ahead and do that in the Q&A rather. Ask your questions. So we'll start with just the basics, and then we'll move to health harms. We'll be talking about federal regulation and then move into state and local regulation, and finally end with a few notes on legal challenges, very recent legal challenges to Zyn. We'll see if we have time for questions, but again, we're going to try to move through this quickly, and we may not get through everything in time for more questions. Okay, let's start with the basics. What are oral nicotine pouches? So these are a commercial tobacco product. They are small fiber pouches that are filled with nicotine powder or nicotine salts. So unlike chewing tobacco or snuff, nicotine pouches do not contain tobacco leaves, either cut, ground, or powdered. So oral nicotine products are often referred to as smokeless. Colloquially, we'll hear people use that term. Technically, that's correct. They are not combustible. They're not heated or burned. But it is important to note that smokeless tobacco products as a term is a term of art when it comes to federal regulation. So this is a little reminder, refresher on what the FDA categorizes as smokeless tobacco products. You'll see that we do not have nicotine pouches on there. All of these products, some of them are in pouches, some are in, some are loose, but all of them contain tobacco leaves in some form. Again, we don't see nicotine pouches on here. They are probably most similar to snus, which is typically found in pouch form and does not require spitting, which is similar to nicotine pouches. So what are they made of? Each pouch contains nicotine, and the nicotine can be derived from tobacco leaves or synthetic nicotine made in a lab. Zyn claims to be derived from tobacco leaves, whereas other brands claim to use synthetic nicotine. It is important to note that nicotine presents the same health harms, whether it's derived from commercial tobacco leaves, to commercial tobacco, or synthetically derived. So in addition to nicotine, each pouch also contains fillers that are added by manufacturers, like microcrystalline cellulose, which is a fancy way of saying refined wood pulp, sweeteners like xylitol and other flavors, as well as preservatives. And this is a helpful, kind of instructive picture that tells you where they go and how does this work. It's placed, the pouch is placed between the lip and gums. The nicotine is then absorbed through the gums and the lining of the mouth and into the bloodstream. These products have earned some kind of strange or interesting nicknames. They're Zyn, for example, or nicotine pouches are called upper decky or lip pillow. With these pouches, as I mentioned, there's no need to spit. So unlike oral smokeless tobacco products like dip and chew. So the user would swallow saliva that would be, of course, in some ways mixed with the product. These pouches are kept between the lip and the gum for up to an hour. For example, Zyn's website recommends up to an hour, but we know that users sometimes place them there for longer. And in fact, there are reports of users sometimes sleeping with them under their lip. But once they're done, once you've completed that time with it placed there, the pouch itself is removed and discarded. So we'll talk about nicotine concentration levels. It really varies according to the product. Zyn, for example, comes in 3 and 6 milligram sizes, concentration levels. Pouches with 6 milligram nicotine concentration were the most commonly sold product between 2019 and 2022. But sales of nicotine pouches with 8 milligrams increased faster than those with lower concentrations during that same time. We've also seen products with nicotine levels as high as 15 milligrams a pouch and even 21 milligrams. We've even seen here in our state of Minnesota an exploitation, I might add, of our state bird, the loon. Loon Nix, it has a product with 28 milligrams of nicotine per pouch, and it's called Bad Bull. So alarmingly high concentration levels. Nicotine pouches have been sold in the US for about a decade, but they're really exploding in popularity and their sales are really skyrocketing. The popularity is on the rise. For example, sales of nicotine pouches, including these flavored products, increased from 126 million pouches in 2019 to 808 million in March of 2022. The most popular nicotine pouch brand is Philip Morris International Zyn. Many of you have probably heard of it. We'll come back to that in a little bit. Other brands include Altria's On, Swisher's Rogue, and British American Tobacco's Velo. But new brands of these nicotine pouches are popping up regularly. They come in a range of flavors, such as mint and coffee. They also have what are called concept flavors like Zyn and Chill or Zyn Smooth. Some users report mixing the flavors. And Zyn, of course, is especially popular among college and high school students who enjoy this flavored nicotine. So I'm just going to talk again briefly about some of the statistics we're seeing and some of the information we have about who uses nicotine pouches, but the caveat is that we're trying to better understand who uses them and how. The biggest increase we believe is in users is among youth. So we do have some findings, very recent findings from the 2024 National Youth Tobacco Survey. And this was data gathered between January and May of 2024. And they showed that during 2024, nicotine pouches were the second most commonly used tobacco product among youth. The first, of course, was e-cigarettes. Just a couple years ago, nicotine pouches were the fourth most commonly used product. So they're increasing in popularity. In contrast, e-cigarettes use rates are going down among middle and high school students. They decreased from 10 to 7.8% from 2023 to 2024. But nicotine pouch use is holding steady. 2.4% of high school students reported current use of nicotine pouches. Among those students reporting current use, 68.7% reported using Zyn. So again, it is the most popular product, followed by On, Rogue, and Velo. 85.6% of folks, these youth that were used a flavored product, which again is unsurprising. Mint was the most popular at 53%, fruit 22%, and menthol at 19%. So another recent study, I just should note, the American Journal of Preventive Medicine found a higher use rate for nicotine pouches among youth and young adults. They found that 16% of participants had ever used a nicotine pouch and 12% reported current use. So I think there's a real concern that many youth and young adults are using nicotine pouches dually with other tobacco products like cigarettes or with vapes. And again, there's other data that supports the idea that perhaps these rates are higher than this youth tobacco survey would tell us, including high percentages of continued use after trying. So again, the nicotine pouches are really gaining in popularity among youth, largely because of the obvious. Why are they popular? I'm sure you've deduced it, but just to recap and to add a few more points. There's colorful packaging. Of course, again, they're very discreet. I think that's one of the most concerning parts of these products. There's a way to get a nicotine fix without alerting adults to the use. So there's no smoke, vapor, or spitting. You're not going to have the offensive odor or smell. They're small. They're very easy to conceal. They really look like a tin of mints or gum. There's lots of flavored products. And in addition to recreational use, there have been reports about students using these products as a performance-enhancing drug, either for academics or athletics. I think students, what we're seeing is students view many Zyn products and nicotine pouches more generally as safer than smoking and vaping, and that parents also may believe that this is true or may believe that they are safe. They come in, as we said, a recent study shows that because of the variety of flavors, the marketing messages, including that makes people feel comfortable in social situations, and the ability to use these products anywhere, all contribute to and are primary drivers for nicotine pouch use for kids under 21. So the star of the show, Zyn. Zyn was created by Swedish Match. It's been available in the US since 2014, but in 2022, Philip Morris International acquired Zyn. So this is really part of the tobacco industry's shift to selling, quote, smokeless products, and looking really towards, as regulation of e-cigarettes and cigarettes increases, and pivoting to a different product to maintain sales. Zyn markets itself as smoke-free, spit-free, and hands-free. That's on their website. Philip Morris claims that Zyn accounted for 72.8% of the nicotine pouch market by the end of last year, 2023. Between 2018 and 2023, the number of Zyn cans shipped in the US rose from 6 million to 350 million in that 5-year period. The company is actually predicted to sell 580 million tins in the US this year, and that's up from 385 million a year earlier. In February, and this will not surprise anyone. They're looking to increase production to meet demand. In February, the company said it planned to spend about $1 billion this year to invest in bolstering U.S. production of Zyn to meet this demand. For example, Philip Morris will be building a $600 million factory in Colorado. Okay, so the marketing of Zyn. One of the things that Zyn offers is a rewards program. This might be reminiscent to some of you of earlier days with cigarettes of Camel Cash and Marlboro Miles. And really, this is a very troubling way of profiting from addiction. These Zyn cans have reward codes that are scanned, and then users can collect points, and then they can exchange them for products like gift cards, coffee machines, cooking grills, headphones, you name it. There's a whole bunch on the website. There's also an interesting page on their website about We Care by Zyn, which really demonstrates sort of a philanthropic approach to marketing for users. But one of the most troubling and most prominent ways that these products are marketed is through significant social media campaigns, including on TikTok. And, there's even a term of Zynfluencers who promote products to viewers, many of whom are minors. And there are videos on TikTok tagged with Zyn that have millions of views. I think the last I read was somewhere past 700 million. Philip Morris claims it does not pay social media influencers in the US, but of course, these influencers do make money from TikTok views and engagement. Media personalities and influencers are spreading a lot of myths about nicotine pouches. We've even seen claims that nicotine is a work-enhancing drug that can be used for, quote, biohacking. Again, TikTok is a prominent area for marketing and using these reward programs. Just as a note for tobacco products, as long as the reward is not more tobacco products, it's legal to do so, but bans on branded merchandise apply to both combustible and non-combustible tobacco products. Despite this, we are hearing reports from social media users that they have received branded merchandise from Zyn. And nicotine pouches are also, of course, marketed through point of sale, radio, and television. Another interesting element to this product is the way that it's being associated with certain groups and demographics. So it's popular with Gen Z. The marketing is ebbing and flowing, but one of the latest illustrations of this is a trend towards Zyn and nicotine pouches being associated with masculinity. Men seem to be emerging as the most vocal and visible customers or promoters of Zyn. It's even being politicized, and this was true in the lead up to the election this fall. It became especially popular among podcasters like Joe Rogan and other conservative media personalities, and also Tucker Carlson. And so notably, I mean, his name was even changed to Tucker Carl Zyn, cleverly. He was a big proponent of Zyn until very recently when he was not, and said it was, quote, not a brand for men. So these are kind of intertwining these two themes. And apparently it related to political donations made by Philip Morris to Kamala Harris's campaign. So he pledged to start his own nicotine pouch company and has sort of been in opposition to Zyn ever since. And he did, actually. He did create his own company. It's called ELP. It started producing or being available for purchase last month with flavored products in 3, 6, and 9 milligram nicotine concentration levels. And you can see the launch party pictures. And again, that intertwining of politics and product. Okay, so we're going to talk a little bit about the health harms of nicotine pouches. Just a reminder, not that you need this, but there are no safe tobacco products, including nicotine pouches. Nicotine is a highly addictive and toxic substance. I'm actually going to read from the slide, even though I'm told I'm not supposed to do that, of course, we all know, but it's just worth saying this out loud because I'm fearful that the sort of messaging about these products is really hiding the most obvious truth. The US Surgeon General has found actually that nicotine is comparable to heroin in terms of addictiveness. We know that nicotine use is particularly harmful for teenagers and young adults, as their brains are still developing. They're greatly impacted by addictive substances. The flavors make nicotine addiction and its consequences much worse. given the way the molecules interact with the brain, especially in younger people. Youth can start showing signs of nicotine addiction quickly, even if they're not using tobacco products regularly or daily. And using nicotine during adolescence can harm the parts of the brain that control attention, learning, mood, and impulse control. So adolescents who use nicotine may be at increased risk for future addiction to other drugs. Harmful substances like hazardous chemicals and carcinogens have been found in nicotine pouches. Okay, it is very early, and one of the most frustrating things is that we don't have a lot of great data. I know that everyone is joining, hoping they're going to find more, articles and research to point to. There is some, but really it's very early in this world of data. And we're hoping that the focus will be on these products to better understand the long-term harms in particular. But we do know that already we're seeing issues with stomach problems, gum damage, cardiovascular issues. We know that nicotine pouch users may go through a single can in as little as 2 days, depending on the strength of the concentration level. It's extremely concerning. There's a Times article that recently talked about a single 6 milligram pouch is dosed so high that first-time users on TikTok have said it caused them to vomit or pass out. We know that the long-term risks are not known yet because obviously we haven't had enough time to study it. But we do, of course, still know that nicotine exposure can negatively affect the cardiovascular system. Dentists are already reporting seeing gum injuries in patients who use pouches. And there are concerns that gum damage may also lead to tooth loss. And of course, again, the long-term neurological effects on nicotine on young people will take longer to observe, but there are real concerns about that as well. Okay, harm reduction in nicotine pouches. I just want to be very clear, nicotine pouches are not nicotine replacement therapeutic products. They have not been approved as cessation devices. There's no evidence that they can help someone quit smoking or vaping. And despite this fact, they've been marketed as a safer alternative to cigarettes and e-cigarettes. We know that nicotine pouches have inherent health risks, regardless of whether they are combustible. I just want to mention a recent state policy statement from the American Heart Association. I think this has some good language about the particular concerns that we're seeing with nicotine pouches. They tend to deliver substantial amounts of nicotine and are often used in addition to combustible cigarettes or other products. And we know that they're attractive to young adults and adolescents, and this increases the risk of dependence, addiction, and harm. So the other thing I want to note is concerns about the environmental harms of nicotine pouches. So obviously nicotine is toxic, not only to the human body, but also to animals in the environment. Another area that has not had a lot of study, and we don't have a lot of information to share at this point, but we just want to mention nicotine is still classified as a hazardous substance by the EPA. We have a lot of really helpful webinars and resources on our website that talk about tobacco product waste in particular. They're not going to get into nicotine pouches specifically, but this is an area that's really in need of exploration. We know that these pouches are discarded after use and likely still contain some of the nicotine that came in the pouch, either residual or depending on how well it's been or thoroughly it's been consumed, it may have quite a bit. And the question is, where are they placed? What is done with these pouches? To what extent are they littered? Where are they ending up? We're already hearing about discarded pouches being found on school campuses, for example, in playing fields, in bathrooms, and urinals. If it's anything like vapes, they're probably being flushed down the toilets. So even if they are disposed of in the garbage, the question is, or especially if they're discarded in the way I was just describing, are these products leaking or seeping into the environment through the ground or wastewater, et cetera? Again, an area that really deserves some exploration, but an area of concern. Okay, we're going to talk a bit about federal regulation now. So the Tobacco Control Act and nicotine pouches. How do federal laws and regulations treat nicotine pouches? Again, we're just going to kind of quickly move through some of the most basic information. This will just be a quick recap on federal law and regulation, and a note that we have quite a few materials on our website. I will give shameless plugs for our website throughout the presentation, but a lot of resources discussing more in depth what the Tobacco Control Act covers, and various processes under that, regulatory processes. So the Family Smoking Prevention and Tobacco Control Act has given the FDA authority to regulate, quote, tobacco products since 2009. Since 2016, when the deeming rule was promulgated, all products made or derived from commercial tobacco are considered tobacco products under the Act. Since 2022, synthetic nicotine is also covered as a tobacco product. And again, remember that these products are sometimes made from nicotine derived from tobacco and sometimes synthetic nicotine made in a lab. Regardless, they are covered products because the FDA regulates nicotine pouches regardless of what the origin of the nicotine is. Don't worry, we won't do too deep a dive on the pre-market tobacco product application known as PMTA process. We could, again, spend the whole webinar on that, but I did want to mention we have probably in the past. So again, look for resources. This is just a quick reminder of how the process works. Generally, new products, so post-2007 tobacco products, must apply for and receive marketing authorization to be sold in the US. There was a huge backlog when this happened at the FDA when they were trying to process applications. They were working their way through, but what they clarified, the FDA clarified after the deeming rule was issued, all products with PMTAs submitted. So if you've got a pending application by 2020 and then there was an extension, they're permitted to remain on the market until the FDA makes a decision about the application. So again, there are lots of products, not lots, but there are some products that have actually submitted these applications, but have not received an answer. They have not received a denial order or a grant, an order authorizing their marketing. So what the FDA has said is you can stay on the market as long as you've got this pending application. So they have temporary permission essentially from the FDA to continue selling their products. So Zyn, Velo, and On all fall into this category. They submitted applications and are awaiting a decision from the FDA. But many nicotine pouch brands have not submitted this application. And so it is illegal for them to sell these products. Again, we don't have time to get into discussion of the public health standard, which is a whole other piece to this. But if you haven't already, there was a great webinar, I think within the last few months, probably in October, talking about the 34 FDA authorized e-cigarettes. And that has a great discussion of the public health standard and harm reduction and some of the other themes that we're talking about today. So I encourage you to watch that. Okay, so just very quickly, when it comes to nicotine pouches, they cannot be sold to people under 21. We can't give away free samples, and they cannot make claims that nicotine pouches are less harmful than cigarettes without FDA authorization. What the FDA is doing is surveilling the nicotine pouch market to see if such products are being sold to underage consumers. So, for example, the agency sent youth decoys to attempt to purchase nicotine pouches at retailers across the country between 2023 and 2024. And then the agency issued 119 warning letters and 41 civil monetary penalty complaints against a bunch of brick and mortar retailers for selling to underage consumers. This was in April. They were engaged in selling various flavors of Zyn nicotine pouches to underage, to minors, folks who are underage. And the FDA has also issued warning letters to 3 online retailers for the sale of unauthorized products, including flavored Zyn products. And in January of this year, in 2024, Senator Chuck Schumer called on the FDA and the FTC actually to investigate Zyn because of growing concern about underage sales. So there's a lot of activity. And as you all know, this is a product that's been around, but it's really growing in popularity. And so the response, the feeling is that we need to catch up in terms of responding to enforcing both regulations and also considering what else can be done to limit the reach of this product, which is a great segue to state and local regulation. So we will talk about the gold standard with the caveat that we realize there is a reality that also lives in tandem, or maybe it is the reality. But let's just start with the gold standard when it comes to policy making in this area. The best practices would be for state and local laws to define commercial tobacco products broadly enough to include tobacco or nicotine, regardless of the source of nicotine. And ensuring that all policies and restrictions cover nicotine pouches in their definitions. That's the name of the game. So flavor sales policies, online sales policy, all of this would in theory cover nicotine pouches. I'm going to start with the Public Health Law Center's model comprehensive definition. And you can see here, this language is intended to capture all the products that are out there and capture, without reaching too far, what products might be coming down the pipe. So you can see that this is a very comprehensive definition. The emphasis is on nicotine in any form and consumption in any form. So you can also see the exception for FDA-approved nicotine replacement therapy drugs. And this definition that we're showing you here can be used in any policy to regulate on a state or local level. You can incorporate it. Obviously, when you're drafting new laws or policies or educating about them, the goal is to use this model comprehensive definition. Okay, what about existing state and local laws? This is the reality part. Do they cover nicotine pouches? And it really, I mean, you're going to love this, but not surprisingly, it depends. It really is a case-by-case analysis. And you'll generally want to be looking at definitions, like I said. And I think this will probably feel very familiar to a lot of you because you probably did a version of this with e-cigarettes years ago or to this day, potentially, and trying to understand, do the existing definitions found in your laws and policies cover this new product? So the question is it expansive enough in language to cover it? Does the language maybe narrowly focus on smoking or chewing or tobacco leaves? Is there a definition of snus or smokeless tobacco that could include nicotine pouches? It really depends. And obviously there's a question about how the courts, well, first of all, whether there'll be a promotion of this by public health departments and, taxation and finance departments, et cetera. But then we'll have to see what courts will say about these definitions as well. But I think the other thing to consider is to the extent that the language does not, it may be difficult to argue that nicotine pouches are covered, you may consider amending the language with this comprehensive terminology or definition to ensure that nicotine pouches are covered. It really depends on your situation. So these are just a couple of laws to be considering. I don't need to tell you, but just in case, as a recap, you may want to revisit your underage sales laws. Again, depends on the language that you have there. If you have these state level laws, smoke-free air laws, typically the way that they're defined, it would not include this. There is not smoke or vapor as part of these products. Tax laws, another tricky area. There have been challenges with definitions that some of them are too narrow. Sometimes it is an example of where they're focused on chewing or on smoking. And then sometimes there's a carve out for a separate definition for vaping that doesn't capture nicotine pouches. So the real question is, what does your state or local law say? Outdoors and parks, sometimes these are focused on the smoke element, but if they're tobacco or nicotine-free grounds, they may capture it. Again, really depends. And then finally, retailer license. It depends on the language, but again, potentially this could be covered depending on how it's defined. And then I just would mention there are some real world examples. We don't have a whole lot of time, but taxation. Minnesota just recently redefined the term moist snuff to ensure that nicotine pouches were captured. There was a change to the laws, to the language of the law and the coverage to add nicotine or similar product containing nicotine. Again, states are going to have to grapple with how to best achieve this, depending on what their existing language says and the political will and the process to do so. So the last thing I'll mention is the Navajo Nation also recently adopted a tax on nicotine pouches. So we know there's some activity, and that's something we're certainly going to be keeping an eye on in the future. Okay, so what else can state and local jurisdictions do about nicotine pouches in their communities, particularly if there are concerns about state preemption limiting local regulation, which is a real concern for many folks on the call, I would imagine. I'm just going to name a few things again. We don't have a whole lot of time today, but first of all, public awareness campaigns raising concerns about the harms of nicotine pouches, dispelling myths. And obviously, to some extent, this is about broader than just sort of among policymakers, but also understanding and helping educate parents and schools and school communities, given the prevalence of these products among youth. These campaigns could be directed towards students, administrators, as well. So enforcement of existing laws, both federal tobacco 21 underage sales laws, as well as any state or local laws, again, depending on how it's defined. The enforcement element is real, and that's certainly a huge concern, is access for youth. But it is also important to mention that there is a way to make a complaint to the federal government, to the FDA, for example, with brands that are being sold, either where they're being sold unauthorized brands that have not got a pending application, or if they're just being sold to underage youth. So you can report either one of those violations to the FDA. So that's one step you could take. And then, of course, there are also local policy efforts, voluntary policies. So in schools, and many of you may have schools where it already is covered. Nicotine pouches are included in definitions. Maybe first taking a look at that. We want to emphasize, and we've done many webinars and done many resources on this topic. Non-punitive measures are critical. The goal is, of course, to remember that this is an addictive product. Youth have been targeted, but we do want to make sure that we're providing support to students and parents and schools. And the first step is to make sure that these products are covered. The smoke-free outdoors is another area, especially locally with events and that sort of thing. Again, I think there's an environmental argument that could be made in addition to the health harms to humans. There is an environmental concern as well. Okay, just want to mention a couple of very recent challenges to Zyn in particular. And don't worry, this is the final stage of the presentation, and we're going to get some of the driest information. But you should know there are legal challenges to Zyn. There was a case filed in March in California. It's a federal class action lawsuit in the Eastern District of California. And this was basically kind of mirroring Juul litigation in many ways. It's brought under the California deceptive sales and marketing practices, false advertising, those kinds of claims, consumer protection laws. And the idea is sort of saying you're aggressively targeting highly addictive products to youth. And that case is making its way through the litigation process. So we'll be certainly keeping an eye on it. But this was just, again, back in March, so very recent. Another lawsuit was filed less than a month ago, actually, in federal court in Virginia. And the complaint there was that Swedish Match was violating federal and state antitrust laws in their market for modern oral nicotine pouches. So this is more of a business angle, but ultimately they're saying that they were essentially attaining monopoly power illegally through a series of business actions and trying to knock another competitor drift out of the market. So again, we'll keep an eye on those cases. Okay. So in June, the District of Columbia's Attorney General issued a subpoena to Philip Morris, and they alleged that its online sales violated the DC ban on flavored nicotine. And so this DC law bans sale of all flavored tobacco and nicotine products, including synthetic nicotine. It's got a nice comprehensive definition. And back to what we were speaking about earlier, that's the key to make sure that these products are covered. It includes products that are made or derived from tobacco. In response, the company suspended all online sales. And you can see that actually continues to this day. They've continued to suspend online sales. Shortly thereafter, there was actually a nationwide shortage of Zyn. There is maybe some dispute about the causal relationship between those two events, but nevertheless, there was a shortage. And then very recently, as of literally last week, last Friday, there was a voluntary settlement reached between Swedish Match and the District of Columbia. And so I'm just highlighting here a couple of the terms of the settlement. $1.2 million paid to the district. And Zyn is going to monitor distributors to take steps and ensure compliance with the flavor ban. And we don't have to get into the details of that, but the other thing is that it's prohibiting future sales of flavored products. So this is a kind of real-time, both definitionally and also enforcement-wise, we're seeing that action is being taken. And so that's a nice, helpful example. Like I said, very current example. And so I think the main question is sort of what's on the horizon. There's still a remaining question of what will happen with the FDA. Will it grant Zyn a marketing authorization order? We don't know the timeline for that. That's a frustrating thing that I think many of you are probably wondering what's happening and how long will it take? We don't know, but we'll certainly be monitoring that. There's a question of whether Swedish Match would seek a modified risk tobacco product, MRTP authorization. Again, we won't dive into that fully, but essentially that authorization allows a company to market their product in a way that talks about how the product is puts you at lower risk of various illnesses like mouth cancer, heart disease, lung cancer. We do know that Swedish Match did get that modified risk tobacco product authorization for a different product, a smokeless tobacco snus product back in 2019, and that was just renewed for another, I believe, 8 years. And so there is a concern that those will be granted, but we'll have to certainly keep an eye on it. There's a question of whether more litigation will follow, whether there'll be other legal challenges to Zyn or other nicotine pouch companies. And really one of the biggest things that I think we're all hoping for is more information and data and research on these products and the impact and the health harms and the concerns that people have and understanding the best way to address them. So we're almost out of time. I don't have a crystal ball, unfortunately, so I can't answer all those questions I just raised, but we'll certainly be keeping an eye on it, including developing additional resources as necessary. And I know we covered a lot of ground today. I'm guessing, hopefully we've answered several questions you have, but we may have raised other questions and not gotten to them. So please make sure that you enter those into the Q&A, and we'll take all of those and review them. And like I said, to the extent that we can, we'll certainly include that in future resources. The other thing I want to mention is that obviously at the Public Health Law Center, back to that one of those earlier slides, we provide legal technical assistance. And so, as is always the case, if you reach out to us directly, and we've got these different ways of reaching us, we can help you with your individual situation, which is always going to be easier in terms of questions about coverage and definitions and policies. So we are here. You saw that picture with a bunch of photos of smiling attorneys and policy analysts and support staff, folks who are here to help. We'd love for you to reach out to us. And another reminder that we have a lot of resources on our website that you can check out as well. So thank you again I've seen some questions coming in throughout the webinar, and maybe what we'll do is see if we have time for one question. I see if my colleague, yes, Stephanie has rejoined us.
All right, thank you so much, Kelly. And yes, we did, this is a webinar slotted for 45 minutes. Do know we will host future webinars, as Kelly said, focused on specific topics. We'll take a couple of questions or a question now. I do know if you submitted a question in the Q&A and you did not select the anonymous option, we can follow up via email. But we will start out with the question, can you provide clarification about whether the pouches dissolve or if they are discarded? And if it's the latter, are there environmental risks that schools and parks departments should be aware of?
Okay, that's a great question. And I've seen that term dissolve used. The product, so the pouch itself does not dissolve. I believe when people either they're wrong about how they're framing it, but potentially what they're talking about is the nicotine salt or the powder dissolves, but the pouch itself remains. So you're right, and we talked about this a little bit earlier in the presentation, but it must be discarded. And absolutely there are environmental risks, and we talked about a few of those that folks should be aware of. And again, I think one of the things that not to sort of be too redundant, but nicotine is toxic. It's classified as a hazardous substance. And we know anecdotally, certainly, that nicotine pouches end up on the ground and in various ways disposed of improperly. So this is a huge area that we should be keeping an eye on. And we again, clearly need to have additional study of it.
Thanks, Kelly, for that. Do we have time for one more? Should we do one more?
Sure.
Sure. Okay. What is the balance of state versus federal regulations and prevention efforts when it comes to smokeless tobacco products? And so what steps can states take in absent of federal changes?
Yes, it's a great question. Again, I don't have a crystal ball. There are lots of unanswered questions, I think, about and uncertainty about the federal government at this stage, this moment in time, particularly the work of the FDA. But I did outline some places where states can take action, like taxation, TRLs, underage sales enforcement. I think there are other areas that we could consider, like minimum pricing laws. We know these discourage youth initiation and help with cessation, comprehensive flavor restriction policies, and we have definitions for that as well. That would cover nicotine pouches is also an area that states could pursue. But as is always the case, state and local efforts are hugely critical, always, and certainly even more so in this particular political climate.
And we are at time, as we said. Thank you. The chat has been super engaging. Thank you so much. As the Q&A, Zoom helps us gather those reports, so we will take those questions and information and get back to people as soon as we can. But we want to thank you so much for joining us today. Please do take our webinar evaluation survey if you have a couple of minutes. The webinar is being recorded, like we said. We will hopefully have it posted within the next couple of days, and you will receive an email once that recording is posted, as well as a PDF of the slides. I hope you have a wonderful rest of your day. Thank you so much, Kelly, for a great webinar, and we will hopefully see you on a future webinar. Thanks, everyone. Bye-bye.
Thanks, everyone.